quieten and settle. As you can see, there are numerous procedures that are okay in the emergency department. But there are some that, like meatloaf, you should say, I won't do that. And the question is, what are the meatloaf manoeuvres? What are the procedures you should not do? So I went up the mount looking for inspiration and spoke to the gods of trauma. And the gods of trauma gave me the 10 commandments of procedures in the emergency department. And I'm going to give them to you so that you too can take them to your departments and profligate and spread the word. So the first commandment is, thou shalt not do thoracotomies on dead people. The question is, what is a dead person? A dead person is someone who has blunt or penetrating thoracic injury and after that has had more than 10 minutes of CPR. Or it is someone who has a blunt thoracic injury who has no signs of life. And the third is the person you think, I might just open their chest. But you have no cardiothoracic backup. These people should go to white lady funerals. They are dead. The second, thou shalt use an EZ-IO in shocked adult and paediatric patients if you cannot get an IV line. It is easy, it is quick. The third commandment, thou shalt give adequate deep sedation to patients who have suffered a dislocation in your ED. This, my children, is why God has given us ketamine and propofol. Number 4, thou shalt not do DPLs in the emergency department. If you think someone has a small bowel injury, with your clinical acumen and good CT, you can go for laparoscopy, or you can go for laparotomy, or you can observe them. But it's not the place to practice with junior surgical registrars to see if they can get into the peritoneal cavity. Commandment number 5, thou shalt learn how to put an IDC in and know when you should image the urethra in pelvic trauma. Learn to respect your urethra. Commandment number 6, thou shalt use liberal amounts of local anaesthetic when placing a chest tube in, and thou shalt put it high. It is said that a lower chest tube is called an abdominal drain. Commandment number 7, thou shalt embolize any ongoing bleeding in the nose or in the pelvis if you can't stop it. Learn to love your interventional radiologist. Commandment number 8, thou shalt not test the integrity of the pelvis by compressing it, doing a handstand on it. It tells us more of the integrity of the doctor than it says of the integrity of the said pelvis. Number 9, thou shalt only comment on fast examinations if thou is accredited. If you're not accredited, don't speak on your or anyone else's fast examination. And the final commandment, and probably my favourite commandment, is thou shalt not do rectal examinations on trauma patients. Because, as you know, thou should not covet thy neighbour's arse. It has a sensitivity of between 0 and 50%. That's not good enough for a screening tool. These are the 10 commandments that I would like you to take to your EDs and put them into practice and become followers of me. Thank you very much. I must be off to part a sea or two.